Good morning, everyone, and welcome to the WellMed Charitable Foundation Caregiver Teleconnection session. Today, we have two experts with us on caregiving from different walks of life, and it's why it makes our presentation so interesting is because of all of our different takes on things, including all of you, our participants. But let me tell you a little bit about Dr. Elliot Montgomery Sklar. He's a public health professional with 2 decades of experience in supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and for caregivers in Canada, Florida, and virtually. Dr. Sklar is a professor of health science at Nova Southeastern University in Florida. He publishes and presents his work internationally, focused on the complexity of issues related to aging and caregiving, which you can find online if you look him up. Yes, and he's got a really cute picture there too. And Lucy Barylak has a master's degree in social work from McGill University, has dedicated her career to supporting caregivers. Lucy was the founder and long-term manager of the Caregiver Support Center at a respite program for family caregivers. In 2003 and 2012, she received the Queen's Jubilee Award presented by the Canadian Home Care Association for her dedication in developing a national coalition to support the issues of caregivers. She has been a key architect of screening and assessment tools of family caregivers and provides training to professionals across North America. Lucy would also like you to know on a personal note that she was a caregiver for her mother for about 10 years. And with that, Lucy and Elliot, thank you so much for joining us. Thank you for your time and all the research you put into your presentations.
Of course, thank you. And before we formally start, I just want to say welcome, everyone. And really, this is a program that affects all caregivers universally. It doesn't matter whom you're caring for or what the person's condition or health status is. At some point, caregiving ends and moving on can be very challenging.
Thank you, Elliot, for that. That's so true. Good morning, everybody, and welcome. We're so happy that you're with us. You know, we always say that caregiving is a journey and nothing stays the same. Caregiving demands a lot of time, attention, and changes our normal routines, and even the energy we have to be social and do the things we used to enjoy. In the journey of caregiving, there is a finality that all caregivers anticipate and need to be thinking of, even early in the caregiving journey, because maintaining your sense of self is so crucial to your coping along the way and just managing. So our focus for our time today isn't as much on grief as it is about how caregiving can change our routine, our interactions, and how we spend our time. So after caregiving ends, there are multiple voids or losses that a person can experience. We'd love to get your input and welcome you to share your own experience and questions as we go along, as Evelyn said, and you'll have that opportunity. You know, in many of our programs this year, we've heard from caregivers about how important it is to maintain a sense of self during the process of caregiving. This is also so important ahead of when caregiving ends. We always tell caregivers how important it is to care for yourself, and that includes maintaining your interest or your social engagements or hobbies, and we know how challenging that can be when you're so busy. There's only so much energy that we have, but it's crucial to balance the demands of caregiving for this very reason, because caregiving does end at some point or another. So one of the greatest challenges among caregivers is a feeling of isolation in their caregiving role, which can be caused by a withdrawal from previous hobbies and lifestyles. While friends continue on their daily routine, some caregivers are left to feel alone in their caregiving duties. Likewise, caregivers without support from other caregivers in similar situation may feel as though no one really understands their situation. At a personal level, I can tell you as a caregiver, many times I felt that way. However, some caregivers may also find that they are literally facing isolation. For instance, a spouse caring for their partner may be providing care on a 24-hour basis and feel unable to leave the care recipient. Thus, their time for personal rejuvenation is reduced to nothing, as they focus only on their loved one, spending time away from home only for doctor visits or weekly runs to the grocery store. The lack of social interaction and stimulation from individuals other than their care recipient, especially when cognitive impairment is present, can be a huge trigger for loneliness. While feeling alone in your struggles as a caregiver will have obvious emotional impacts, there also can be unexpected physical side effects caused by the onset of depressions. Now, caregivers report weight gain due to the emotional eating, increased blood pressure caused by stress, both of which can contribute to complications such as diabetes, stroke, or even premature death. Although not all caregivers will experience such serious physical and emotional effects caused by isolation or loneliness, even the slightest feeling of being alone in your journey as a caregiver can have a significant impact on your overall well-being, making you less able to focus on work, family, and responsibilities besides the person that you're caring for. So here are about 10 tips to help caregivers prevent losing their identity and maintain self-worth while caring for a loved one. So this, as Elliot said, this is really important. Should be a beginning, like even when you're first starting out, of what you really need to do. Now, we talk a lot about this. Prioritize self-care. Remember, there's two people in this relationship. One does not outbalance the other. It's important to prioritize your care. Make sure, it's a non-negotiable part of your routine. You have to include that every day. Dedicate time each day for activities that replenish your physical, emotional, and mental well-being. This may include exercise, relaxation techniques, hobbies, or engaging with friends and loved ones. Set boundaries. This is very hard for caregivers to do, but it's so important. Establish clear boundaries between your caregiving responsibilities and your personal life. Learn to say no when necessary and delegate tasks to other supportive individuals. It's okay to say no. Setting boundaries ensures that you have time for yourself and prevents burnout. Seek support. You're not the only ones that can do the job. It might not be as good as you think, but it's okay. Reach out for support from family, friends, or support groups. Share your experience, your concerns, and emotions with others who can offer understanding and encouragement. Having a strong support network can remind you that you're not alone in this journey. Now, maintain social connections. Again, very important. Stay connected with friends and maintain social relationships outside of your caregiving role. Schedule regular outings or phone calls to engage in conversations unrelated to caregiving, all right? Nurturing social connections help preserve your sense of self and prevent isolation. Preserve personal interests. Don't let go of your personal interests and hobbies. Crave out time to pursue an activity that brings you joy and fulfillment. It doesn't have to be as often as it was before, but don't give it up. Engaging in your passion allows you to maintain a sense of identity beyond caregiving. Practice self-compassion. This is a big one. Be gentle and kind to yourself. Acknowledge that caregiving is challenging and it's normal to have moments of frustration, exhaustion. Practice self-compassion by offering yourself understanding. Forgiveness is a big one, and self-care during difficult times. Okay, you're not superheroes. None of us are. Set realistic expectation. Accept that you cannot do everything perfectly, that it's okay to ask for help, Adjust your expectations to avoid feeling overwhelmed or inadequate. Celebrate small victories. Now, this is one that's really important to acknowledge, that when certain things happen, acknowledge them. It can be as simple as a smile from the person you are caring for, or successfully managing a challenging task, for example, getting them to take a shower. Recognizing those victories reinforce your self-worth and boosts your own morale. Take regular breaks, respite, so important. From caregiving duties to recharge and rejuvenate. Whether, it could be whatever it is. It just be a little short walk in nature, a visit to a coffee shop with a friend or by yourself. If you could possibly ever work out a day off, that would be amazing. Time away from caregiving allows you to reconnect with yourself and prevent burnout. Explore personal growth. I know, for example, in my experience, even though I was and I'm a professional, I experienced that I learned things about myself that I didn't know while caregiving. Reflect on the lessons learned, the strength that you gained, the resilience you have developed. Consider pursuing other things that you really like and interested in. Remember, taking care of yourself is not selfish, but necessary in order to provide the best care for your loved one and keep yourself healthy, both physically and mentally. By implementing these tips, caregivers can maintain their identity, preserve self-worth, and navigate the caregiver journey with greater resilience and well-being. Now, I know it's not easy. I went through that myself for over 10 years, but it's something that is necessary. So I've said a lot and gave you a lot of experience, but now I want to open it up to the audience. Does anyone have any tips that you'd like to share that I haven't talked about, or any personal experience?
So folks, if you're on the phone, you can press *6 and unmute yourself, and I will call you by your area code. And if you're on Zoom, please just unmute yourself or put your hand up or go to the chat room, whichever you like to do, because we would love to hear from you.
I know that what I was saying, there's a lot to take in, and it's okay. Just think about it. You'll have another opportunity to reflect on that. And just to think of things that maybe, that you've experienced and that you would like to share.
There are a lot of good tips that you have included here. And I think people have their own experiences, even if they haven't necessarily shared them with us. Again, feel free to enter something in the chat, for example. I work with a lot of caregivers. Oh, we have a chat. Hang on. It was just a thank you. I work with a lot of caregivers in my local community, and some other tips or things that people had shared with me. One lady used to be an artist, and she kind of gave that up as her caregiving responsibilities for her mother increased. The thought of taking art classes or taking on a major project felt too daunting to her. And instead, what she did was went to Michael's, which is a craft store, but you can buy these on Amazon or Walmart. She bought small canvases and really inexpensive paints, watercolor paints or acrylic paints, and it gave her something to do with her mom together that allowed her to connect to something that she used to really enjoy. And what they would do is then hang the canvases that they would paint together using those command strips that don't damage the walls in her mom's room. And so it sort of lightened up the room at the same time and allowed her to have some rotating artwork to always look at. And I have always remembered that because I thought it was such a nice way of honoring something that she loved doing with her mom while providing care. And now these canvases for her have become keepsakes now that her mom has passed on. Someone else in the same group had shared with me that they love reading. But because of their caregiving responsibilities, they find that at the end of the day, they're just too tired to pick up a book and read. And I can well appreciate that. And instead, they turn to audiobooks because it doesn't require the same level of concentration. And if you're feeling taxed, you can sort of close your eyes. And whenever she had a few minutes of respite, that is what she found herself doing, especially when her father would take naps or at nighttime once he would be asleep. And I thought that that was a great idea as well because it provides a little bit of an escape. These are just examples of how hobbies and to integrate them. Um, that's something we didn't talk a lot about is adaptation. And as we know, caregivers adapt a lot all the time. As Lucy said, caregiving's a journey, nothing stays the same. So we might have to adapt the things that we enjoy doing. But it's so important to stay connected to the things that bring you fulfillment as well. And I do see we have some things here in the chat, which I will share. Sarah said, take time to realistically assess your own mental and emotional health. I had developed depression, but thought it was just stress. That's such an excellent point. And I think that that's something also that a lot of caregivers experience during the process of caregiving, but especially after the experience of caregiving ends. That sometimes is the first opportunity people have to go and see a primary care physician. And so we might find ourselves, receiving diagnoses of different physical and mental health issues. And it's important to seek out care and help. We also had another comment from Griselle. Try to get other relatives involved and take turns when caring for loved ones. Some adult day centers and ALF may also provide respite at their facilities. It's an excellent point. There are a lot of different resources in everyone's community. You can always call 211 in your local community to find support groups, as Griselle also suggested, and other programs, certainly, that the WellMed Charitable Foundation offers through the Caregiver Teleconnection. There are other programs that the foundation offers as well, which you can find information on the website. But these are great examples that these individuals participating today have shared with us. Great tips, and I thank you for your input, certainly. I think these things are also important, and we all process things, we all move on, we all heal in our own way. And it's important to acknowledge that too. Many, many years ago, I used to run programs for seniors and caregivers in Miami Beach. And in one of these programs, I had an older lady who attended these workshops every week without fail. As we got to know one another better over the course of time, I learned actually that her husband had passed away months before she had started attending these programs. And it was interesting to me at the time. But her entire life had become consumed with caregiving. So she started participating in caregiver groups, wanting to share some of the things that she had learned along the way. And we find that this is a common experience for caregivers, especially when the journey ends, because it's still you may have had for a very long time. And what this lady had also shared with me is that through the experience of caregiving, she felt very estranged and disconnected from her friends over time. And she felt a greater sense of social ease being around other caregivers, especially right after her husband had passed away, because people could better understand what it was that she had been going through, as she had looked after her husband for a period of almost 10 years while he battled Alzheimer's disease. So when he died, all that she knew outside of caring for him was the potential of going to these caregiver groups and sharing with others. And what helped her to cope was that sharing, that caring that continued. And so we do hope for some people that you might find that you do get some fulfillment of sharing your experiences with others, which is why we find this platform of the teleconnection to be a very meaningful one for many caregivers and also for healthcare professionals to better learn the experiences of caregivers. what we used to tell other caregivers, and what this lady actually used to tell caregivers in this group, was again to make time for themselves during the journey so that they were not like she was at the end, where she felt disconnected from her friends, disconnected from her hobbies. Um, but the good thing was that she found the resilience in herself to find a different outlet. And that meant sharing with others and helping them through their experiences, especially through some of the challenges that come with caregiving. I think also when I was in my late 20s or early 30s, when I met this caregiver, her experience really struck a chord with me because I had worked with caregivers and seniors and, taken classes learning about all of the different things that are involved with gerontology. But no one had shared their experience in such a way that made me feel so connected on a human level. So I was wondering if anyone participating today has any thoughts, anything they want to share, or ways that they might recommend other caregivers can reduce their feelings of isolation in the process of caregiving.
Okay, folks, you can press *6 if you're on the phone, and I have a little website so I can see that. And it looks like we've already got somebody who has opened up their mic, and that's Darlene Gowder.
Yes, ma'am.
Please go ahead.
How y'all doing?
Good. How are you?
Good. It's interesting to me because I've been doing this a long time, ever since my grandmother fell. She was 90 and she fell and broke her hip. We didn't have to have license or anything then. And I've been doing it ever since. I just like seeing their face when they're happy.
That's a very important point that you're making, really. To see the joy sometimes, the positive aspects of caregiving is so important. It's not all negative. And
Right.
when you see that, that's what makes it, that's what we're talking about, to be able to look at those moments and to recognize that you're doing something that is positive, you're sharing with the person that you're caring for.
That's
So
right.
that's a great point. Thank you for that.
You're welcome.
Elliot, I love this picture of the train and the shadow of the woman in her early days. It was very interesting.
Yeah, I try. What looks good is good, and being a professor, I try very hard to make sure that our presentations look as good as our content. We had a great comment here from Gay, who said, I just had a support group where the participants talked about how frustrating it can be to be told to take time for self-care when they're overwhelmed with the challenges of caregiving, that it brings up anger rather than comfort. It is important to have a list like this to include whenever the topic is talked about, rather than just saying it's important. It's also important to validate these feelings, allow them to vent this frustration and anger. And I thought that that was such a great comment, because we tell people all the time, self-care, self-care, but what does that mean? And some concrete tips and examples of things that we can do are sometimes very helpful, as well as acknowledging the anger, the feeling overwhelmed, the not feeling like there is time for self-care. But I think it reinforces a lot of what you've said too, Lucy, that, that if you don't care for yourself, there are consequences of that too.
And I keep repeating myself, there are two people in this relationship. One does not outweigh the other. We don't want to have two people being sick physically and mentally. So that balance is so important. As part of your task to be able to continue caregiving is to take care of yourself.
We have an
Barbara, go ahead. And then I'll read what Barbara wrote.
for Ray Coleman. Please go ahead.
Yeah, that's a good question for us. You got to take care of yourself before you be able to take care of your other. And I feel that's very important. And like I said, that's what I try to do every day. I got to take care of myself first in order to take care of my mother. Oh, not my mother, but my brother-in-law.
Good for you. Remember when you're on a plane, what did they tell you? Put your oxygen on yourself first
Right.
and then put it on the person next to you, because only then could you be helpful. That's a great point. Thank you so much for that.
Yes.
And we had a chat from Barbara. I agree with Gay that often there is a reaction of anger when talking about self-care. How would it be best to deal with this? Lucy, do you have some thoughts?
Well, as we go along with our presentation, we're going to cover this, I promise you, because we're definitely going to talk about grief. We're going to talk about how to move forward and exactly what you're asking.
And Sarah just wrote, one doesn't outweigh the other. That's a really difficult idea to accept and internalize when it feels like the other person's welfare is your reason for being.
Yep, I can certainly appreciate that, because I felt that very much, being an only child to my mother and having to take care of her. But very early on realized that if I don't take care of myself, I really will not be able, not only not physically, but mentally. I didn't want to be angry. I didn't want to be frustrated. I wanted to be able to get to a point where what I'm doing is because I want to do it and I need to do it. But it's not easy. It takes a lot of practice. And that's why we keep reinforcing it. And we're going to continue reinforcing it with our presentation.
Absolutely. And I also think, Sarah, to your comment, when you focus on the things that we're talking about, the giving yourself time, the not feeling overwhelmed, it allows you to pivot your experience of caregiving from a negative to a positive. And there are many positive aspects of caregiving. There are many wonderful things about being the reason why someone is able to live as well or enjoy a quality or comfort of life that they're able to. And it's thanks to you. You know, there's a huge, huge significance to that, I think. And that's why we always celebrate the role of caregivers, because what you do impacts another person's life exponentially. So with that, I will continue on with our presentation, and I want to share another tactic because we talk about the loneliness that can come with caregiving and the isolation. And one thing that I think has been very helpful for many caregivers, but it's also been studied in research and shown to be actually very effective. Not research when it comes to caregiving, but research when it comes to sales. And this is to have conversations with strangers when you go shopping. So we talked about how some of the only experiences caregivers have interacting with other people might be going to the pharmacy or going to the grocery store. Well, talk to someone when you're in line. Say, oh, I really like your shirt or your jacket. Sometimes it's just the easiest way to strike up a little bit of an interaction or a compliment or anything, but it allows you to talk about the weather, just to interact with another person. If you've ever been to the grocery store at Trader Joe's, or if you've ever shopped at the Gap, I used to work at the Gap when I was in high school and in college, and we were always taught when someone comes to the cash and buys something, compliment them on what they're wearing or what they're buying. It allows you and them to feel a sense of connection. When I go grocery shopping at Trader Joe's, the people who ring you out and speak to you, they're very friendly. They always say, oh, I love this hummus or whatever you're buying, because it's, again, a way of connecting. And it really does work. So if you find that your time is limited, as one of our caregivers shared, and you don't have time for self-care, you probably don't have time for interacting with friends, interact with other people. It doesn't matter who they are or what the extent of your exchange is. There's a lot of benefit mentally from having that interaction. That's also why we've heard from many caregivers that they make it a point to get respite once a week to be able to go to an exercise class. That could be stretching, it could be Tai Chi, but in that there is also the opportunity for social interaction. I was at an 8 a.m. Pilates class this morning. I'm the only guy in the class, and I'm the only person not in their 60s or 70s. There are a lot of caregivers in my class, and we form a community for one another. There's a lot of benefit about these short interactions to counter isolation and loneliness. And it's really important to think about the amount of time that you spend overall providing care. What would you do with all that time if you weren't providing care? Can you start to incorporate some of that into your life at present? And that's part of why I'm such a big proponent of exercise, because it's something you really can do from anywhere at any time, and it really benefits our physical health and our mental health. It's also really, really helpful for dealing with grief and for healing. So these are things that we can start doing ahead of time. And I want to discuss what I think is very important, especially among caregivers of people with Alzheimer's and related dementia, is something called anticipatory grief. And that's a sense of sadness or even grief ahead of a person's passing. It's almost like grieving the person while they're still alive. And it can happen with a pet. It can happen with real life in which we know that time is finite and limited. In reality, all of our time is finite and limited, but I don't like to live my life that way. It's not a very optimistic view. As more illnesses are becoming managed and chronic diseases, for example, many cancers now are being treated as chronic illnesses. People are living longer. The goal isn't necessarily on curing a disease, it's on managing it. As this has happened, we've been hearing a lot more about anticipatory grief. For example, people diagnosed with cancer thinking that they only had a certain amount of time, and with new immunological therapies, people are living for years. This also happened back in the 80s and 90s, well, really the 90s, with HIV as different medications hit the market. So there's a lot of research behind anticipatory grief, what it feels like, how it changes your experience of loss. It sometimes is referred to as preparatory grief, preparing for grief. And this is really the distress that a person might feel in the days, months, could even be years before the death of a loved one or impending loss. It's very common among caregivers with diseases for which there are no cures or degenerative diseases like MS, Parkinson's, Alzheimer's, as I mentioned. There's also a lot of interesting research about anticipatory grief and age. The younger that a caregiver is, the more severely they may experience anticipatory grief, particularly as it relates to death. There was a recent review of about 15 studies that looked at anticipatory grief and illness, and it came out of the University of Illinois at Chicago. And this study found that younger caregivers and also younger patients tended to report higher ratings of anticipatory grief. One of the reasons for this is that grief, when it is anticipatory, it's forward-looking, right? You're preparing for something that hasn't happened yet, but that you feel is inevitable. And younger people tend to think more about the future. So it's not surprising that younger caregivers reported more anticipatory grief, which is really the grief of what we believe we might lose. I don't think that this is unique to just younger caregivers, though. Many people, even as we age, think forward. We don't only think in the past. So if you're someone who likes to plan, thinks ahead, you might also be someone who anticipates things a little bit more. And so anticipatory grief may be an experience of your caregiving experience. It also does leave space for hope, however unrealistic, that the loss might not occur. So there are some good things, there are some bad things about it. But let's talk about what it actually feels like, because some people might be experiencing it and not even recognize it. So anticipatory grief might include a range of feelings that you would also see when grieving, like anxiety or irritability, anger, denial, withdrawal from social situations. That happens very often where people feel like they can't go somewhere in case something might happen. Desperation, dread, a lot of guilt as well. Many people feel guilt when someone passes. again, very common with caregivers. We think, what more could we have done? How would we have done it better? But we do the best that we really can. And sometimes that's hard to sort of come to terms with. There's also the intense preoccupation with the person's passing, worry, anxiety. You may not be able to sleep through the night because you're checking on them, which can lead also to a lot of fatigue, sadness, fearfulness, loss of control over your emotions. So if you're experiencing these symptoms, I think it's very important, and Lucy would agree, to talk to someone, because grief is a universal human experience. There are many resources that we're going to share after our program today and that you can find on our recorded programs as well. But we always recommend, if you're feeling any type of crisis, reach out to 988. It is a free hotline that you can call from any phone to connect with a crisis counselor. You can also find groups that focus on grief in your community by calling 211. There are so many different ways of finding resources nowadays, and our program is one of them too. So I do see that we have a comment in the chat that I will read, and then I will pass the torch to Lucy. Griselle shared that people in Miami may be interested in attending the Managing Alzheimer's and Dementia Caregiver course. You can find Griselle's email in the chat. Gay shared that caregivers know it's important, but especially when things are falling apart and when they don't have access to the support needed to help them care, it can feel like they're failing or don't have self-care. Our healthcare systems are failing in helping caregivers in this journey. That's why those of us who are privileged to be part of supporting caregivers during their journey develop the skill of listening to the pain and frustration before jumping in with trying to make them feel better. It's not much different from what we help caregivers do with the person they are caring for when that person gets upset. Excellent, excellent point. And thank you so much for sharing that. I think Lucy and I agree. I think that's also why we're here. You know, I'm a healthcare professor. Healthcare education is patient-centered. Caregivers are secondary to that. And we need to make sure that we change that, because our healthcare system is structured where we don't have the resources, and therefore family caregivers are crucial.
100%. You know, sometimes caregivers, all they want to do is just to be listened to, just to be able to have an opportunity to talk. And so it's not about finding solutions. Yes, it's important, but just to have someone to talk to. Thank you for that. Very important. Okay, so are there any other little chats, or should we move forward?
We can move on.
Okay. So Elliot and I receive emails from caregivers. We wanted to share one of them with you and to talk a little bit about it. And the email says, for the last 8 years, I was a caregiver to my mother. My father had passed away when I was very young, and I have no siblings. When my mother was diagnosed with Alzheimer's and I felt responsible to care for her, it affected my marriage, which ended in divorce. I had no capacity to work full-time, be a full-time caregiver, full-time partner to someone that I loved. It wasn't fair to anyone. My whole life has been wrapped around my caregiving for my mother, who passed away this winter. Though I know it was coming, I have found myself so lost, so lonely in everything I'm feeling and experiencing. I don't even know how to begin with the process of moving on and rebuilding a life for myself. So first of all, I just want to say condolences on the passing of your mother, and to say how sorry I am for all that you have gone through. It must be so overwhelming, and so many feelings must be floating in your mind. The one positive thing that I do hear is that you are trying to find a way to begin the process of moving on and rebuilding your life. You know, that is the first step to your healing journey. But I do feel that you need time to process all your losses in life. You gave up so much of yourself to care for your mother. I would highly recommend that you give yourself the opportunity to grieve for all your losses by going for counseling and exploring where you're at now and where you want to go in the future. In general, I'm going to kind of give tips to anyone who's listening to us today about the whole grieving process. You know, the Caregiver Alliance has some great resources on grief and loss, but also on moving on. And you'll have that link in our resources that you can go on yourself. You know, according to them, the most common feelings and needs following caregiving include, obviously, grief. You know, it's normal to feel sad, angry, hopeless, deprived, devastated. In our society, it says you should get over it in a week or two or in a month. Actually, it often takes 1 to 2 years. Allow yourself these feelings. They are normal and appropriate. As long as you don't feel that you're depressed and you cannot move forward, these are normal feelings that you do have. And if you are very depressed and you can't move forward, you need to see the doctor as soon as possible. Now, for some caregivers, there's a sense of relief. Many caregivers feel relieved that their ordeal is over and that the care receiver is no longer suffering. This is not something to feel guilty about. It is one of the many feelings that people have when caring ends. Grieving may have started many years before with a gradual letting go process, particularly with dementia. And I remember going through that myself, knowing that I kind of lost my mom. The other thing that's so important is forgiving yourself. Caregivers often feel guilty about every time they were not the perfect caregiver. There is no such thing. We're human. Everyone can get impatient, angry, frustrated, unkind at some point during the caregiving journey. It's okay. Don't second guess yourself with the quote, what ifs? You probably couldn't have done anything else, even though you are thinking you could have. Celebrate how well you did this job. Now, sleep is huge. Often one of the first feelings caregivers have is you're totally exhausted. Now is the time to sleep. You need to renew your energy. Sometimes you need to stay in bed for a day and cry, or just put the covers over your head and watch TV. You deserve to take a break. You might enjoy the quiet and doing nothing. It's okay to just do nothing. Keeping in mind your mental well-being as well. Give yourself a time frame, you know. I always share this. I always give myself 1 day. Okay, feel sorry for yourself, Lucy, cry, whatever, do. But the time limit is important to make sure that you're not getting into a pattern of depression. There is confusion. Caregivers put their lives on hold in order to be a caregiver for many, many of us. Now you're out of the job that you held for the past several years, and you might have to redefine your purpose. That's what this is all about. That's what we're talking about. It's normal to feel adrift as you try to find your place and the world and figure out who you are now. Now, the other thing is the whole idea of how do you re-enter, time, what to do with it. You were so busy before. Time was structured for you while you were caregiving. Now you have to figure out what to do each day. You learn good time management skills while you were a caregiver. Use these skills now for you to achieve new goals. Celebrate having time to reflect and make new decisions. Thinking about the future can be scary. Take 1 day at a time. It doesn't all have to come together immediately. Now, we talked about loneliness, and it's still going to be there. If you were lonely before, you're going to be lonely now. There can be an empty void that comes from not being needed in the same way anymore. Since caregiving is so all-consuming, caregivers often end up isolated when caregiving ends. You often have to rebuild a social network, make social engagements when you feel you want to, but also allow others who invite you to do things back into your life by saying yes, okay? Give yourself that gift. Give yourself the opportunity. Now, activities, that's another one. Take some small steps in re-entering into life again. Identify activities or hobbies that you enjoy, that energize you. For example, volunteer. Many caregivers, I think, and Elliot spoke about that. Many caregivers find their skills can be used to help others. They actually go volunteer in support groups, and it's so beneficial for other caregivers to hear that they were in the same position. Exercise. This is Elliot's main word, exercise. It is so important. It might have been a long time since you were able to focus on your needs. Your body now needs attention. You might also need exercise. Take a class, read a book, or even a newspaper, whatever it is, but with doing activities. But exercises, I have to tell you, there's amazing videos. You don't have to go to a gym. There's videos, and one of them that I love, stretching for seniors. I really love it because it really makes me feel good and it's helpful. Take care of you. Exercise, get enough sleep, and eat right. So important to eat right. The three things we all have to do, but now you can. You had to be strong for someone else. Now you can be strong for you. But you can also not let down and express your vulnerabilities. You have the right to the full range of emotions. Always acknowledge your emotions. Now you can feel them. Caregivers' financial situation often changes when caregiving ends. Make sure to pay attention to finances, whether your situation is better or worse than before. Get help if you need it. Seek counseling if you need support, or just talk through all that you have been through and continue to go through. Embrace life now. It's a cliche, but every day is a new beginning, right? Appreciate the skills you learned while caregiving and find a way to use them. You did things you never thought you could. Appreciate your strength, create a new focus for your life, maybe find a new job or a new interest. It's okay to enjoy life again, to laugh and play. It's not being disloyal to the person that you loved and lost. Realize that you have to invent, quote, a new normal for what you've been doing and what you've been going through. Make your home your own again. Now, these are easier said than done, but I think if you take one step at a time, if any of these tips relates to you that you feel that you could accomplish, start off by doing something small. I really feel it's important to kind of have kind of a schedule, like you did when you were a caregiver. There was a schedule that really worked. Make a little schedule for yourself every day. It doesn't have to be overwhelming. But remember, no one will take care of you the way you can take care of yourself.
Absolutely. These are amazing points, and I'm sure people will want to refer back to them. I think it's important also as we move on that we remember that grief is not a linear process. That means that there's no straight road. It's not a beginning and an end point. There might be triggers along that road too, like birthdays or anniversaries or holidays. Again, all the more important why it is necessary for us to build coping skills, because these come in handy at many points after caregiving. And something, Lucy, that you mentioned, speaking of handy, we talk a lot about home modifications for caregivers to make their home more accessible for their care recipient. We don't spend enough time talking about modifying your home to make it yours again after caregiving ends. And it's really important that we rethink our spaces and make them healthier for ourselves. So that might mean repainting, changing a piece of artwork, removing a grab bar from the shower. Certain things are obviously going to be easier to do than others, but it's important to think about those things too. And before we wrap up, because I am sensitive of time, I want to remind everyone again what I mentioned before. Counseling. crisis intervention. There is a lot of research, but we also know from our own experience, this is so beneficial. And there are so many online and by phone opportunities to access mental health counseling now through telehealth, through telephone. In fact, a study came out just on the tail end of the pandemic in 21 that said that telehealth was an extremely effective tool in delivering caregiver interventions that led to significant improvement in caregiver outcomes like quality of life, mental health, physical health. That's what we're doing here today. So join us for future programs. Spread the word about this program, please, if it was of benefit to you. I also want to remind everyone again, 988 is an amazing mental health crisis resource. And I'm going to put up a slide here with all of the resources that we have to share. Anything that you see that has a green underline is a hyperlink. So at the beginning of the hour, we were asked for the website that has all of our recorded programs. I've included the Caregiver Teleconnection YouTube channel. Lucy and I have also done other programs that focus on health promotion and disease prevention. We did a series called Our Health is Our Wealth. And in that series, you can find expanded information about many of the things that we talked about today, like exercise and stuff like that. So I hope that this has been helpful for all of you. And I want to thank you so much. And if anyone has any last questions or comments, feel free. But I know Evelyn has some last information to share as well.
Do you want to take those last two chats?
Yes. Selena just shared my local university does free counseling services in person and Zoom. I've been doing it for 2 years. It's great. And yes, many colleges and universities offer free or low-cost counseling services. Gay shared the support groups I've been facilitating for over 3 years. Whoops, just missed it. Because we got another chat. Are maturing enough so we have those who are still caregiving, as well as those person they were caring for who have passed on. It's valuable for both to continue with the group. I agree. They all say that in addition to any counseling, the support groups are in some way even more valuable since they're given an opportunity to share with others who understand. Very much like the story that I shared of that lady that I met early in my career who made an indelible mark, obviously, because I think it is so important for people to continue on in support groups. They have a lot to share, right? We learn a lot in the journey of caregiving, and there are many other people who can benefit from that. And lastly, Susan said, this was very helpful. Sarah just asked resources for grief support groups specifically for caregivers who are grieving. There are some in here on this slide. In addition, I would recommend reaching out to 211 in your local community because there may be some community-based support groups for you.
Fabulous.
Before Evelyn, you go, I just want to thank everyone so much for joining us. And please remember to take care of yourself. Each day is a new beginning, and it's up to you to find the simple joys in your life.
And what a great way to honor the person for whom we may have cared.
Carry their light.
Their memories never go away.
Well, I want to thank you all, but most particularly our presenters who do such a lovely job of research to put these together, in addition to the wonderful answers to questions and comments. I mean, it's just great. You folks are so good at it. And I want to thank all the caregivers today for what you do. It's a very hard job you do. And I would like to thank the WellMed Charitable Foundation for all that they do for caregivers, just in recognition and trying to promote the issues of caregivers. And I know that they work in Washington, D.C., just like our friend Elliot does on his national committees. And thank you all. And we do have 3 more sessions yet coming up this month. If you have someone with FTD, we had ALS earlier in the month. And I think ALS and FTD are known to be two of the most difficult diagnoses to get from a healthcare professional. And so frequently it's late in the disease before you know that somebody has one of these diseases. So if you know someone with FTD or someone who's beginning to act a little funny or a little different than they used to, please join us. And that will be next Wednesday. The following Monday on the 25th, we have a Spanish rendition of palliative care, taking care of hospice. And this is all in Spanish, people with dementia. So you'll get that if you got your monthly calendar, you'll be able to see that. On Tuesday, August 27th, we have family dynamics and caregiving, coping with conflict and engaging family members in care. And that's always a difficult one. We've had many questions about that over time. When other members of the family refuse to help or feel like, hey, you're doing a good job. We don't want to take it away from you, or whatever the feeling is. It's how do you get past that point? How do you get the support that you need from your family, if it's possible? And with that, I just want to thank you all. And we had many thank yous to our wonderful presenters. It was such a great heartfelt presentation from both of you. Thank you so much. And I am going to stop the recording now, and I hope that you will join us in many more. And yes, we are sending out the slides so we don't need to do a post-session questionnaire. We do it now online, but whenever we have resources, we always send those out a day or two after the presentation. So you'll be getting all the information, the great tips, lists of tips, and just talking about the things that you can do if you are in a grieving state, which probably you all are. Yes, at some point, as Elliot said, it's a road, it's a journey. So thank you all so much, and we hope to see you again very soon.
Thank you all so
everybody.
much.
Be well.
Yeah.